Look, before we kick off, a disclaimer. I'm not qualified to teach you O2 or defibrillator. Okay, so I'm, you know, I've been trained several times in both, and I'm probably, I'm probably the one in the club who used the defibrillator.
Yeah.
So I have some experience. So I'm going to start with oxygen. All the boats that you go on with VSAT should have an O2 kit of some description. However, they're not all the same. They're kind of similar, but they're not exactly the same. So I'm going to show you two different O2 cylinders and just explain the difference between the two. It's important that everybody understands that we've got oxygen on board, understands when we should be using oxygen, understands how to put the O2 kit together, and understands how to administer the O2 if necessary. It's really important. Could save a lot. There's no point in us having the equipment on the boats if people do not know how to use it. So don't be afraid when you get on the boat to ask about the O2 kit. And if you're not sure, ask the skipper of the boat to show you how to put the O2 kit together. Now, some of the boats now are starting to have pre-assembled O2 kits. If there's space, it's a great idea because it means you can get somebody onto O2 quicker. So I want to start with when should you use the O2 kit? So my words of wisdom on this is we've got two scenarios. There's the potential diving decompression injury. And you know that DCS can take many, many different forms. If you do a dive and you get back on the boat and you're not feeling good, go onto O2. It isn't going to do you any harm. And it's not going to cost the club much money to refill an O2 cylinder. So if in doubt, get the O2 out. And don't be afraid to go on it. Yeah? Because if you've got DCS, the sooner you go on O2, the better the outcome for you. Yeah? The worst thing you can do is sit there thinking you might have DCS, but being too afraid to ask to go on the O2, too embarrassed to go on the O2, and delaying getting on O2 as a result. So if in doubt, get the O2 out. That's why they're on the boat. So, second scenario.
Sorry, can I just add to that? Sometimes people that have DCI don't realise it, and you might notice it in someone else as well.
Yeah,
through their
good point.
Or you know they're confused or whatever. So, how would you tackle if you see someone that you think needs it? Is it just making suggestions?
Yeah, I'd stick their arm around the shoulder and say, I'd noticed this about you. How are you really feeling? Perhaps it'd be a good idea if you went on O2.
Yeah. Okay.
I think if anybody on the boat feels somebody should be on O2, they're on O2. In a discussion like, oh, you had an incident where I didn't think guy needed to be on O2, and Maggie said, oh, I think he should be on O2. He's on O2 in a discussion. That's the way it should be, I think. To make a suggestion, and our culture should be, yeah.
The only thing I'm going to say to you, Pete, is that you don't have the right to pull somebody onto O2 if they don't want to go.
No, but at least it should be like somebody could feel there's a problem, let's in abundance of caution, we should be doing it.
Yeah.
And personally, I'm saying no, if any doubt, you go on.
I can talk from personal experience to say that even if you can get somebody on O2, on occasions, that person will not react well to being on O2. They won't like the mask on their face, and they'll fight you the whole way. You can't physically restrain somebody, hold a mask on their face and give them O2. So, you know, you can help them as much as you can, but you know, you can't make somebody go into O2.
But it's a bit like first aid, you can't force someone to take it serious, I think.
But I guess, Ian, to your point, is we just want all club members to know O2 doesn't cost us anything.
Mm.
It's there to be used. It's no embarrassment, it's no shame. Use it. It's a precautionary measure.
Yeah.
You know, I personally, I'd rather that I had to go and fill an O2 cylinder back up. If you come from a dive and you've got a headache, at least I know that you've not got DCS, you've just got a headache. Yeah. So, you know, the list of symptoms on DCS is long, but you know, if you don't feel right, go on O2, because there's nothing that you can have that O2 is going to do you any harm. Yeah.
The incident we had, there was no symptoms, but the person has done a free ascent, and you know, if that's probably another one. There may not be symptoms, but if they've done an ascent, a quick ascent, you know, maybe you should be thinking about them too.
Yeah. So, I mean, I think absolutely. And this is where I think the skipper can enforce things. Someone does a rapid ascent from you, they don't dive again.
Yeah.
So don't let them get back in the water and do another dive. That's where you do have control. They're on your boat. Yeah. Right. So, two O2 cylinders. Club's got some like this. This is the one from my boat. So what you'll notice about this cylinder, it's a standard DIN valve. Okay. Whereas oxygen cylinders generally, this is another O2. I'll turn these around in a second.
The DIN, is that actually a diving cylinder? Have to be if it's got DIN, sure.
Yeah.
I've never heard it, I didn't realise that.
You can, any cylinders can hold O2.
Yeah, no,
Yeah.
It's just a testing house.
Yeah, it's just what valve you get put on, basically. Yeah. So this has got this has got the medical O2 3-pin. Can you see this or not?
Yeah.
Online?
Yeah.
Stay in the room. 3-pin?
Yeah.
DIN.
What are
Yeah.
the different valve types?
Sorry.
The different valve types?
Well, only from a
One's a P, one's a P, and the other's just a normal D, right, isn't it?
I don't know.
Yeah, no, it's called, this one's
called a P valve.
It's a P valve.
Yeah.
So,
I wouldn't personally, I wouldn't get too hooked up in this.
no.
This is a K valve.
Yeah.
Not a J valve. The J valve is the old. There will be some people in the room who remember J valves, and you had the reserve gas and you used to pull the metal. Yeah.
one of those valves in the car.
And because it got switched when you were getting in the water and stuff, you used to pull it, and they'd already had the reserve on. But do you know why they're called J and K valves? Because the old valve with a reserve was letter J in the catalogue, and the next valve to be released was this one, which was K in the catalogue, and that's why they're J and K valves. And that's true. So don't get too hooked up on J valves, K valves, P valves. It means nothing. Yeah, you've got yoke, you've got D, and you've got the medical 3-pin. That's all you need to know.
And can I just point out one advantage of your the yoke? That's what I had in Vanuatu when we went back to the motel at night, because the dive shop had it available and I could use my own regs.
Yeah.
Because they didn't have masks, they had no safety gear. But I was able to use my regs to lay in bed and breathe pure oxygen.
Yeah.
Whereas that I wouldn't have had any equipment with me to adapt it.
If you're ever on a dive boat that isn't carrying O2, but there are technical divers on the boat who have decompression gases, then don't be afraid to speak to those people, because now most boats should be carrying O2. Any commercial boat should be carrying O2, but you know, overseas, something like that, you know, a technical diver is unlikely to say to you, you can't breathe my O2 if you need O2. And it's a good point. There's disadvantage, you know, so if you've got the choice of breathing off your own regulator on a DIN cylinder with a diver's 100% O2 decompression gas versus breathing on a proper mask out of the proper medical O2, then go to medical O2, because you're going to absorb more oxygen through the mask than you are through your regulator. Yeah, so you'll be getting a bigger hit of oxygen if you do it through the mask. But if that isn't available,
if you're stuck, you can get by with it.
It's better to go on that. And although you should be breathing 100%, if you haven't got 100%, but they've got 50%, that's better than nothing. 32% is better than nothing.
That's right.
Yeah, so take whatever you can.
Yeah.
If you need oxygen. Anyway, hopefully on our boats there'll always be 100% O2
And a mask.
and a mask. Right. So putting these together, I'm going to start with the DIN. So O2 delivery comes through 3-pin. So the only thing you can do is have an adapter that turns your DIN into a 3-pin. So in my kit, there's an adapter. So it just screws in, and now I've made my DIN 3-pin. Yeah.
But if you didn't have that, you could just put a regulator.
You can put a
Just
DIN
get
regulator.
less.
Yeah, you'll get less oxygen, but it's better than
Why
nothing.
do you get less? If you put a mask on, you can't breathe through your nose. Why are you getting less?
No, the mask will go over your nose and your mouth.
No, the mask, but if you put your own diving mask on, so you can't breathe through your nose, you're going to get 100% O2 through your mouth.
So I'm not, as I said to you, I'm not qualified to teach this, so I'm going to give you my opinion.
Okay.
Take the medical stuff.
Oh, yeah, I would, but
Breathing through your regs, you find your throat dries out very quickly, and you have to throw the regs out every so often, stop, have some water, so you're breathing 21 while you're clearing your throat before you can go down.
it's
Right.
not going to be any different.
Next thing you've got to do, there's a regulator in the kit. Okay, so you need to attach the regulator. Doesn't matter how you're going to deliver the oxygen, you need to attach the regulator. So these are 3-pin. See the 3-pin here? So it's got 2 sighting nodules, and then the actual valve is here. It is. Yeah. First stage has also got a gauge. And then a difference to anything you're used to currently is it has a dial that changes the flow rate through the regulator. Yeah, so flow rate's important. I'll talk about that in a minute.
Not just to say, because I thought that flow rate there is for this output, not to that. Doesn't have anything to do with that.
You're correct.
Yeah.
Yeah, you're correct. 2 delivery methods. Yeah. And the difference between the 2 delivery methods and why you need to work out what you're going to be delivering depends on the condition of the person that needs the oxygen. Okay, so there's a very big difference between somebody that is conscious, breathing, and can take control of their own delivery of oxygen, as in most of the mild DCS cases, the diver's going to be conscious and and with it and can breathe for themselves, versus a more serious incident where somebody is not breathing. Okay, so the reason that I'm kind of slightly nervous about having O2 kits put together is how you're putting it together. You're putting it together to deliver to one scenario or another scenario, or you're putting it together to deliver to both. Yeah, because it could be either. If you're going to put it together for one, I would suggest putting it together for the non-responsive diver, because that's more serious than.
Now you can remember.
Yeah, you can. Okay, so putting this together. We'll use this one. It's simple. You line it up and it tightens off this side. Okay, now what I noticed with Dave's kit, this is the reg for mine. This is Dave's kit. You just pull that out. The regulator's not put together. It's a space thing with these boxes. Got the same. Got the same first stage. Just a different orientation. Now I've got to put this together. So regulators in here. They're just standard regulator screw fittings. So it screws in. And now that's together. Yeah. To attach these.
They have to be.
Yeah, I mean, I'm getting a spanner out. Finger tight's perfect.
Right.
Yeah.
But these things have a spanner built into the,
Oh, right.
So- yeah, and that's really important because that does both ends of that hose.
Yeah. So our standard scuba cylinder has got a standard on-off valve. Okay. Whereas you look at this one and it doesn't. So to turn this on, you need to turn the top here in the. Is a non-return mask. Okay. The easiest way to tell that you've got one of those they have a bag. Okay. As opposed to
Just that one.
we've got rescue masks. No bag. Yeah. So bag, responsive diver. No bag, unresponsive diver. We'll talk about why in a minute. Okay, these are real simple, real simple. They come with a hose. One end of the hose goes on this fitting here, or this fitting here. Just push on. Yeah. Don't put it too simple to say. Okay. The other end, there's a, where's my bag, Miles? There it is. The other end goes on the same fitting on the mask. Okay, so that's now assembled. Okay. Next thing we've got to do, we've got to turn the cylinder on. Okay, so everyone understands that oxygen is a dangerous gas. Yeah, so what we don't do with oxygen cylinders is crack the cylinder onto full pressure in one go. They need to be opened slowly. Yeah, so I'm going to open this. Slowly. Okay, cylinder's open. There's no, notice there's no flow. Okay, because at the moment the flow rate on this is set to 0. Okay, so what flow rate becomes an important factor here? Okay, because if you have too less of a flow rate, the person at the other end is not getting enough gas. If you have too much, you've got different problems and you're going to run out of your gas quicker. Okay, so the art to this is we want the flow rate to be at the right level. When I allow the oxygen to flow, and you should start, I think, at 10 litres a minute. Okay, it's still not inflated. We need this bag to be inflated before we give it to the person that needs it. So inside the mask, there's a one-way valve. To inflate this bag before I give it to my patient, I've got to cover that. And now my bag starts to inflate. So I want my bag inflated. Okay, it's good. Now this is ready for the person to have. I'm going to turn it off for a second, or I'll turn it right down. Let's turn it right down. Okay, so I've got an inflated bag, oxygen flowing through. I'm now going to offer this to my diver. Notice there's a strap that goes around the head. There's also a metal clip over the nose. Can you guys see that online? Okay. How you make this effective is it has to seal to the face. Okay, so the strap goes over. You then need to tighten it to a level where it's tight on the face. You then can pinch these clips to make sure it's over the nose. Okay, so the idea is I want this to be sealing. What I would advise is have the person hold it. Okay, now they're going to breathe. What we want is when they breathe, we want the bag not to fully deflate. We want it to be about a third full. I've got a really low flow rate. This is going to empty when I breathe. Yeah? Okay. If this is emptying, increase the flow rate. Sorry, talking for the mask. This mask needs to shut. So your flow rate, your ideal flow rate is between 10 and 15 litres a minute. Okay, so start at 10, wind it up to 15, or start at 15, wind it back towards 10 until we get the right result. You shouldn't need to be pumping more through than that. Okay, but maybe someone with, maybe a big guy with big lungs, maybe.
And you're just trying to maximise what the time that they can consume air, oxygen, sorry, in the day. That's really what it's saying.
But you don't want it too low. If it's
Correct.
too low, they're not getting enough.
Correct.
They're not getting enough.
And you're just balancing that.
Because,
So
yeah. because there's an element of you've still got what you're breathing out, right? So we want oxygen in. So this, method, still, I'm not going to say nothing at all. Okay, if you get this right,
It's my fault.
if you get this right, you're getting 80% oxygen out of your 100%. So you're getting a pretty high dose of oxygen. The reason that the club went to these big cylinders is actually on the valves that are with these, there are actually you can put more than one person on this. So you can on this, but you can have a conscious and an unconscious.
But can the conscious diver use the unconscious? I mean, I understand the
No,
other way
well,
around wouldn't work.
it's probably best. It's probably better than not.
Okay.
To be honest with you.
I like these ones. To me, I'd be using that if I'm conscious. And that way it comes back up if I have two divers.
Hmm.
And if they're unconscious, then you can use the free flow and try and do CPR on them. And then I would not try doing, I wouldn't bother trying to do the CPR, I'd just do the compression on the chest.
So this mask, goes on
Yeah,
in a pretty similar
yeah.
fashion.
So if you're conscious, what's the issue? Why wouldn't you use your
Well, if you put if you
You can't inflate their lungs with that if they're unconscious.
So
That's a free flow mask, and if they're unconscious, you can't inflate them. Whereas with the bag, you can pump their lungs up.
No, this is not free flow.
No.
This is demand.
Ah, that's the bag.
I reckon this one gives you.
That's the one.
100%.
That's the one we can push on your face and push the button. Let's see.
Right.
Just try that one out and see
So-
if you turn the oxygen you sit on design.
yeah. So this you have to breathe.
Yeah.
So this is for a conscious diver. I've got them around the wrong way.
Yeah.
I'm really
Right,
sorry.
right.
Got them around the wrong way.
Yeah. So that to me is the primary one. If you get someone who needs oxygen, that's what I give them.
Right.
As long as they're awake.
If you have two divers, then you've got this one as a backup because they can still get it. Or you can
Yeah.
set it to free flow if they're unconscious. Sorry,
Sorry, I've made a massive mistake there. Massive mistake. Got them around the wrong way.
And the bag, you squeeze the bag.
Yeah, you squeeze the bag.
Yeah.
Yeah.
Yeah. I don't see how that would work. That one.
Yeah.
For an unconscious.
This is why trained people should do this.
Yeah, that's good.
Okay, but I gave it a go. So this one goes over. Advantage of that is I'm demanding it, so I'm really minimising the oxygen until I call it. You're absolutely right. This one goes over and then you squeeze it to get it into the lungs.
So that bag one is for your unconscious diver.
Yeah.
If you're conscious, you can sit there and squeeze it yourself.
Yeah, that's what I was gonna say. If you have two divers,
Yeah.
both conscious, and you only have one kid, then that surely is
So,
better than.
Mine is set up with the bag.
But you can still.
Anybody can breathe.
So
through that,
you
conscious or
don't
unconscious.
you don't actually. So a conscious diver could use this.
Yeah, that's what I
You
mean.
don't need to squeeze the bag.
That's right.
Yeah.
Yeah.
So you can still breathe off this.
That's what I mean. So my question was, if you have two conscious divers that need O2, then they can both breathe one on this, one on this.
Yeah, and not all of those ones come with a bag.
Right. Yeah.
There's plenty of them that
Okay.
come without a bag, and
Okay.
it just goes over it, and it just free flows.
Okay.
And
Yeah.
But without the bag, it's not an unconscious diver mask.
yes, it is.
Show me how you inflate their lungs.
You don't have to. It's just.
Hang on.
No, they're not breathing.
unconscious,
No, not breathing, no.
Then it's just there. Yeah, and you won't. Yeah, you're right. And I don't know that squeezing the bag holding it
No.
much down. It won't. But what I like the idea of is because I know when they had that incident just recently, trying to do CPR, trying to, you know, to me, I think that's really hard trying to do the CPR bit. If you come on my boat, I'm not going to try it, guys. What I'll do is I'll put one of these masks on, set the air to somewhere between 10 and 15 blowing there, and I'll compress your chest and you'll get some air in. But I'll just keep doing the pump, and I know that anything that goes in there is going to be down a lot of oxygen in there. Because my boat's not big enough to set up to have people trying to do the breath, the thing, and drive, and so, you know, just be aware to come out. You probably won't get mouth to mouth, but you'll get 100%.
I'll let Natasha.
With the unconscious unbreathing diver, you need to go through. We can debate the DR, right? But what you do need to do is the A, the B, the C. So it's pointless putting a mask on someone if you don't have the airway open.
Yeah.
Right. So you have to tilt the head back, and you have to get the tongue. You need to make sure they're not swallowed their tongue. And you need to think again about the seal of the mask. So let's use the real life example, as painful as it is, but with Arthur, the only way we could get air into Arthur was down his nose, because his teeth were clamped shut and I could not get the teeth apart. So if I'm trying to do this with the mask, his airway's got to be open, and you need a good seal, because he's not going to get much. No, he's not getting much.
That's why I feel if you just set it at 5 to 10 litres per minute and just have it free flowing, and if it leaks, it doesn't matter because it's going to be coming out 100% O2. But you're not going to get much. Like, I mean, cancers are pretty small.
Ben,
You know, sorry, go on.
could I just ask a question? I'm just trying to think through with the unconscious diver who isn't breathing. You're pretty soon going to be into a CPR situation.
Straight away. No,
Okay, you go into CPR.
what I'm saying is, you can't do CPR on my boat. We've
Nice
got the
boats.
gear in there and everything else. CPR is almost impossible.
You could.
You might be able to do chest compressions.
You got a defib?
Yeah.
Oh, you do use the defib.
Use a defib.
Yeah.
I've tried, but I don't think I'd try to. You just couldn't get enough people around them to do
No,
that.
so I'm just trying to think, if you've got an unconscious diver who's not breathing, you're going to be putting a defib on because their heart's going to stop. And then once the heart.
But don't. But it's DRABCD for a reason. It's important to get breaths in and do compressions because that might be enough. Now, if there's multiple people, would I have somebody else getting him prepped or him or her prepped for a defib? Absolutely, but I wouldn't be stopping breaths and compressions while someone's trying to get the defib out and get the defib ready. If you can get a couple of good breaths in, and compressions going.
St. John's don't
Just
do.
at this point, I just want to, for everyone's basis, like the history here.
Yeah.
Ian's talking from first hand experience. At this point. So yeah, so it's not he's been there, he's been at the forefront, so other people in the room, maybe online, but we've had one fatality in the club over 60 years, you know, and yeah, so that's why this is so important and so intrinsic to the club, that for the boat owners, that firstly that have the kit, and secondly, we're always saying feel free to use it.
What's your perspective?
It's interesting because I agree with you, Craig. I teach first aid and CPR and stuff, and there is a change. You don't have to do rescue breaths. If someone's not breathing, just get onto CPR. Ian raised it with me this evening that if someone has drowned or is
They need
in the
breath.
water.
Yeah.
Then rescue breaths, and this is not something I'm aware of, and I'm a trainer, so I need to follow up on that.
So this has come direct from John Littman.
So what's rescue breaths?
2 breaths, and then
Yeah.
you're 30 compressions,
Oh, yeah.
so 2 breaths.
And it's to bulb up blood sugar.
So 2 to 30. You use bubble breakthrough. I like Nelly the elephant.
Okay, that's it. Is it?
Okay.
It's
You know,
whatever you want to
But-
use, but it's.
now you will be surprised. On John's boat, it was cramped, but we managed to get to a point where we had one person doing breaths and one person doing compressions.
It's a big boat too.
Yeah, it's a 6.3 metre,
Yeah.
that's a big boat.
But go back through the D. Everyone's aware of DR. Yeah.
Maybe
S. It's DRS A B C D now. So on and then So
No, sorry, what's DR?
so danger.
Yeah.
First thing's response.
Yeah.
Yeah. So I've got to decide whether they're conscious or not.
Yeah.
The S is send for help, and let's change that in our world. Don't delay. If you've got a problem, call for help. But the lesson that we had from our experience is when you call for help, nobody told us whether help was on the way, how long it was going to be. Assume it's not coming.
Yeah.
You can't wait. Yeah. So then you've got a really, really difficult decision to make. Is like, do I try to do quality chest compressions and breaths, or do I get back to medical attention as quick as I can? And we had a really it was a nasty situation. And I'm doing CPR on Arthur, and I'm screaming at John saying, well, is help coming? Do we know? And we didn't know because he didn't tell us.
What was the R? You said DRS was the R.
That,
Response.
response.
Okay.
So what you should do is, shake, grab the shoulders, get in the face. Can you hear me? Yeah, okay. And kind of,
On the help thing, I mean, even if help's coming and it's going to be quick, if they're not breathing, they're dead before the help gets here anyway.
So,
Not necessarily.
Well, no, but
You've got to keep blood going to the brain, and that's through CPR.
Yeah,
And we've got and there's an animation we might be able to show later.
that's a
Which
great.
shows it, there's just an animation that shows what happens when you're doing CPR.
it's a difficult one, right? Because you think about the people that are coming. Unless you get a paramedic drop from a helicopter, if a rescue boat comes or a police boat comes, they're just first aiders, and they might have an AED, but we already got an AED. They'll have O2. We already got O2, so they can't help you that much, right? They might be able to take over, but actually getting to medical attention as quick as you can probably gives that person the best chance. But again, you've got to think about that, because it's like, how far are you from that?
On that,
And then there's a balance between, once the boat starts moving, trust me, it's very hard to do CPR.
if you're sending for
It's hard
help,
enough when the
if you're
boat's
sending for
stationary.
help, you're better off calling the ambulance to if your boat's ready and mobile and you've got someone on the patient.
I think it's
like,
important to
call-
ask the question, what help is on the way and how long is it going to be?
do you get
And
the
they might
ambulance?
not be able to answer that straight away, but you want them to come back there, because you get, if the help's 15 minutes away, and in our experience, we called it quite soon. The help I passed coming out of Queenscliff Harbour. I was going back in as the police boat was coming out, and that was all the help. That was all the help that was coming to help us.
And that was from the Canberra, you guys had come back.
Yeah.
To Queenscliff.
Because we didn't know if anyone was coming. So in the end, I said to John, we've got to go.
And the other problem was that you didn't have the phone call hung up. you didn't have that ability to call them back.
No, but I've passed that back, so.
Being out of this size tank, at a flow rate of 10 to 15, how long would that last? Do you think about a couple of hours? Would it be?
We bought these because you could get somebody, anywhere we dive, you get 2 people back to.
Yeah,
It's actually on it, but in a sense, like it tells you how many bar it is, so we know what the 10. You're at the surface, so we don't have to worry about depth.
yeah.
So if you're using 10 litres a minute, and that thing tells you how many litres I think is in the tank on the side or something.
When we did the course with John Littman last November, he said, yeah, these big tanks, set it to 15 as your minimum. He said, waste some air. It's just, he said, make 15 your entry level and put the resus mask on as your default. So that's how I set mine up from that point. I've just got to swap tanks.
Can I suggest, like, one of the things we should really run through, and everyone should have a look at this, is if we got the worst case, which we've just spent a lot of time on, we're not, you know, bit of give and take on that. But what we all should know is how to put this on quickly with someone who has DCI, because this gear is really good. When my wife had an instantaneous dive to 21 metres, hit the inflate button on a VCD, and it took it straight back to the surface. We put her on a kit very similar to this. When the ambulance came to Geelong, they took one look at it and said, we haven't got anything better than that. Let's leave her on that while we get ourselves set up. That's how good our gear is, all right? And we know it works if you do have a DCI, don't we, from the people here? So what we need to know is how do you put this together? You've got to have a quick practice.
Yeah, I'm gonna bring one of these down the other end
And
leave one up this.
because where we will get a benefit is someone thinks they've had a DCI or doesn't know or whatever, or has had one, we get a great benefit out of this. It will work. If we've got one of these dead early on the surface and bring them back, we don't have much chance.
I've done
We ought to practice this stuff.
Yeah, I've run through it once and it's like, but I should be doing it a few times a year, really.
Ian?
Yeah.
Coming back to, I know you had a bad experience because you lost communication with
Yeah.
emergency services.
Yeah.
Our training and our instruction is when you talk to WAPOL or whatever emergency service you are talking with, is you take their lead on where the resources are coming from, because there's no point you rushing off the Queenscliff if there's an ambulance somewhere else, or they can get it closer, or there's a resource somewhere. They have access, excuse me, mine's all right. If they know where all land-based, air-based and water-based resources are, and they are the ones that are going to be able to get the help to you the fastest. So don't automatically assume get an ambulance to Port Arlington because that's where we're closer to. They will be in the rescue control centre, the rescue coordination centre, and I mean the comms dropped out for Ian, so that was a disaster. But in reality, they should be able to coordinate a rescue and all other assets.
They can hand on something.
Good night.
No, that's 000, and that will go. Normally, it'll go through water police because it's an on-water thing.
Oh,
But
sorry.
at 000, you tell them what your emergency is, and they will.
If you read 000 and you're on the water, goes to water police.
No, you will explain what your emergency is, but if you're on water, it's likely to go to water police. Yeah.